Hi, Dr. Murray back again, and now we're going to go over the day of your procedure. A very important day, and it can be one that can make you nervous, but like I said before, try to relax, as a relaxed body heals well. One of the first things we want you to do is to fast for at least 6 hours. You can take tablets with a tiny sip of water early, but you must fast from food strictly before your procedure. Chlorhexidine hair and body wash the morning of the procedure, or an antibacterial soap is required as well to wash the body and the hair. Wear loose clothes that are front buttoning, and obviously not your best clothes. A good faithful old tracksuit is a great thing to wear. No jewellery, hair clips or piercings should be left in the body. The procedures on average take 2 hours plus 2 hours recovery. The nurses will call your carer to come and pick you up. So just make sure that they're aware that they've got to leave their mobile phone on for the nurses to call them. The nurse admission, when you come to the day surgery, the nurses will greet you, take you through, go through a whole big checklist of things for you to do. They'll put you in a gown, take photographs of you, and put numbing cream on the back of your wrist so even the drip doesn't hurt. And they'll also take photographs. I will see you after the nurses, and I will mark the area that we will be doing the procedure on. Please make sure that you pay attention to where I'm marking and that you agree at the areas that I'm marking, especially in liposuction and other areas that you want done. We will then take you into our licensed theatre, and monitors will be applied. Usually these are one to the finger for oxygen, and a few dots on the chest to check your heart, etc. You'll have a drip inserted, and you'll be given sedation, and probably my bad joke is going to be the last thing you remember before you go to sleep. Then we make you numb and we keep you comfortably asleep. After the procedure, you'll be recovered in a 2-stage recovery, and when you're significantly awake, you'll be discharged into the care of a responsible adult. Please make sure that that your carer assists you wherever you go when walking, and that you don't get up too much. You actually rest light, pop your feet up and relax for the first day, and don't do too much. If you do get faint, lay down quickly and pop your legs up, elevate the legs and call me. For the breast implant patients, we prefer you to have a wheelchair and use this wheelchair to go to the toilet and back. This wheelchair is available on the day of the procedure, but preferably the day before. It's very small and it can fit into most cars. The night of your procedure, make sure you drink plenty of fluids. Fluids is more important than food. Food can make you nauseated, and be aware of nausea. You can take your anti-nausea tablets half an hour before your food and half an hour before your tablets, especially the painkillers, to prevent nausea. So it's very, very important you do that. The carer is in charge of the medications, and you are their responsibility. They must make sure that you rest, that you don't get up too much, and that you get your medications in a correct fashion. Make sure that you also do your leg exercises that night, and that's where you do 10 toe pumps every hour and 1 to 2 gentle breaths afterwards. Your carer should assist and remind you of this, because you will be slightly forgetful that first night. It is very, very important that you keep your mobile phone on, and your carer's mobile phone on and nearby, as I will call you that night. If I haven't called you by 9 o'clock that night, please ring me. And my phone number, and my home phone number, and the nurse's phone number will all be in the pack provided, your pre-operative pack. It is extremely important that you leave the phone on and nearby. Report any pain greater than 5 out of 10, 0 being no pain, 10 being the worst pain you can imagine. Bleeding, any swelling, leg pain, chest pain, coughing of blood, etc. For most procedures, some light rosé or red cordial discharge is okay, but anything that's dark blood you must report straight away. So that's your operative day. Hopefully it will all run well for you. Don't hesitate to ask me questions about that day. Thank you.